74-year-old Carol Burton,
Old enough to know better and too young to resist, but I'm trying to behave.
is a firecracker with a witty sense of humor.
Well, I'm old enough I can be opinionated.
But what she doesn't laugh about is her health.
It's been in remission for 4 years. I was allergic to the treatment, but so far, nothing's growing.
Carol would say her life relies on her long-term relationship with Dr. Emmett Roper. So when she found out her Anthem insurance may no longer cover her care at Mercy Health, she made a decision.
You know, I'll find a different company, but I won't switch doctors, period.
It happens to impact greatly those folks who are poor, so those folks in Medicaid, and those folks who are elderly, probably the most vulnerable people in our population of folks in our society in general and the people we care for.
Anthem and Mercy Health aren't backing down on their demands. And because of that, people on Medicaid or Medicare Advantage suffer.
Is it bothersome to you, or as an advocate or the spokesperson for Mercy Health right now, to Mercy Health, that, you know, a pretty vulnerable population is stuck in the middle of this? I don't want to call them a bargaining chip, but it certainly seems that way from the outside looking in.
We feel like we're doing everything we can to protect our patients by going through this negotiation and getting a fair market rate.
This could be a very dangerous precedent that the most vulnerable among us, right, in terms of Medicare Advantage members and Medicaid members, are put in the middle of a contract dispute that really has nothing to do with them.
Mercy Health wants an increased rate from Anthem. They say inflation has caused supplies, medication, and labor costs to increase. But Anthem said they just negotiated a contract to account for increased rates 12 months ago.
These contract negotiations weren't up yet. Does that usually happen, that people try to renegotiate before they are even expired?
Typically, no. So as you pointed out, our contracts with Mercy were not set to expire until 2025. What they're saying now is they want an increase that's 3 times what our current inflation rate is. And that, I think, is a little bit too much.
That's just untrue. We're not asking for 3 times the inflationary rate. We feel we've been underpaid for many years. And we have other contracts with other payers that are more in line with fair market value on what we expect to be paid.
In July, about 6,000 Cincinnati area Medicaid patients in the Mercy Health system fell out of network. Now, with an October 1st deadline approaching, about 17,000 Medicare Advantage patients may not be able to see their doctor. Even the Ohio Department of Medicaid noted their disappointment in a letter on July 25th, stating, quote, "It is indeed unfortunate that Ohio Medicaid members find themselves in the position of having to make potentially urgent or otherwise significant healthcare decisions because of a disagreement between 2 established and committed healthcare organizations that have told us that they have these members' best interests at heart," end quote. This months-long dispute is putting people like Carol at risk because she says she needs Dr. Roper, who helped save her life once, to continue to help keep her healthy for the rest of her days.
You know, we've cultivated that relationship over many, many years, and to have it disrupted like that is I don't know, it's wrong if you ask me.
You know, he cares about his patients, that we're not just a number or somebody that comes in and out. There's no way I'll give up my doctors.
Yeah.
Local 12 has more consumer stories just like this. Don't forget to click the links and press subscribe. Local 12 has more consumer stories just like this. Don't forget to click the links and press subscribe.